Welcome back to the Bigger Than Birth podcast, where we're celebrating bigger bodies and beautiful births. I'm your host, Victoria Gaba, and each week we will be bringing you the real stories of plus-size moms as they share their journey through fertility, pregnancy, birth, and postpartum. These stories highlight what it's like to navigate through this experience as a woman in a bigger body in hopes of creating representation for plus-size moms, both present and future. Thank you for being part of this community as we share these stories that are so much bigger than birth. Hey everyone, welcome to today's show and the first official episode of the Bigger Than Birth podcast. I am beyond excited. This has been months in the making, and I'm so excited to share these women's stories. I've had the pleasure over the last few months of sitting down with countless plus-size women, being able to share their stories and their experiences with fertility, pregnancy, birth, and postpartum, and it's been a wide variety. We've gotten the beautiful, magical, easy vaginal births to the very daunting emergency C-sections and everything in between. So it's been such a pleasure to get to sit down with these women, hear their stories, be able to recount what a lot of them consider the happiest day of their life, getting to meet their baby. I'm very honored to be the one to get to run this podcast. This was ultimately started as a light bulb idea when I was pregnant. Through pregnancy, I consumed so many podcast episodes, specifically birth story podcasts. And I think there might have been about 4 that were plus size specific birth stories. And in that time, I wanted to find stories of women that looked like me, that had my similar body shape, that had my similar weight range. And those were very limited, especially when it came to podcasts. There are a lot of groups out there that have been great and a great resource for plus size moms, but I still thought the space was very lacking in representation. So fast forward, my little guy is now about 10 months old, and we started this several months ago, recording and getting everything prepped. And here we are. My goal is to be a resource for plus size moms, present, future, trying to conceive in their fertility journey, wherever you're at. If you are a plus size woman wanting to be a mom or about to be a mom or are a mom already, I want this to be a safe place for you to enjoy birth stories, to have people that look like you and represent you in the media, and to just really create a community that is helpful, that can put anxieties at ease, and to be able to share these amazing mom stories of childbirth. So I am super excited that you're here. I'll finish rambling for today. Today's episode is not only special because it's the first episode, but I'm actually going to be sharing my birth story. So we will hop right into it. So I like to say that my birth story and fertility journey kind of starts well before I was even thinking about having a baby. So we will rewind back to 2019. I was 25 at the time, had been married for about a year, was living in Nashville. And after being married, we were like, yeah, we know we want to have kids in the future, not right now necessarily, but I wanted to go ahead and get checked and make sure everything was good. So at that time, I had an IUD. I thought, okay, let me go ahead and take out my IUD, let my body have time to regulate, because with my IUD, I did not have cycles at all. Maybe once a year, but that was very generous. So we go to an office in Nashville, and I'm able to get checked by a gynecologist, let them know that, hey, my IUD is about to be up at the time range that it's good for anyways, but I want to go ahead and have it removed. So the doctor goes in and she gets ready to do her check and to be able to remove the IUD. And she tells me that the strings on it are actually so short she can't grip it with whatever instrument she was using. So I'm like, oof, that doesn't sound great. And she's like, no, well, it could just be that whoever put it in cut the strings very short, or it's possible that it's moved into an incorrect place. Again, that doesn't sound very good. So at that point, we scheduled to have an ultrasound to be able to see where the IUD is and remove it properly. So fast forward, I think it was a couple weeks, and we go in to get the IUD removed. They're able to find it with the ultrasound, and she tells me that where the IUD was placed, it wasn't preventing pregnancy anyways. So again, who knows how long it had been like that, but I've had it almost 5 years at that point. I hadn't had a pregnancy scare. So, I mean, who knows if I had a pregnancy scare, because I wasn't having a period. But anyways, At the same time with the ultrasound, she asks me if I've ever heard of PCOS. And I think 2019 was very early in the trendiness of PCOS, so to say. And I had heard it mentioned, but I didn't really know what it was, had never considered it was something that I had. And so the doctor talked to me and she said, because I got my little extra chin hairs, I am overweight, and the ultrasound showed pockets of cysts on my ovaries. But actually, with PCOS, they're not technically cysts, it's just a lot of follicles all around. And so, with those things, she was able to officially diagnose me with PCOS. During this diagnosis, she tells me that unfortunately, with PCOS and my body size, that it's going to be extremely hard to get pregnant whenever we're going to be ready. At that point, it wasn't super devastating to me because, again, we weren't planning necessarily to have kids right away. Younger me also didn't even know if I wanted to have kids. At this point, I was married and thought I would, but again, no time soon in the future. So I took this diagnosis. She prescribed me metformin, tried it for a couple weeks, tore up my stomach. So quickly quit that. And we just kind of moved along. I no longer had birth control. We were being careful, but we weren't technically preventing, and nothing happened. We just kept moving. Nothing happened, including my period returning. So, still had a completely absent period. In my mind, I'm like, great, I don't have to deal with a period. Fast forward several years, we've moved back to Georgia. And I think at this point it's 2023. And I'm like, hey, now we've been married for almost 5.5, almost 6 years. And we're going to start, thinking about having a family. I had convinced myself based on, at this point, what I had learned about PCOS, what that doctor told me, that it was going to be incredibly difficult for us to get pregnant. So, to be able to help our chances, because we weren't trying right away, I deemed that my getting healthy for pregnancy year. I wanted to get healthy for myself in general. I wanted my husband to focus on health. And if a pregnancy resulted whenever we decided to start trying in a year or two, great. If not, we'll go to our next step. So I start with weight loss. I was on a GLP-1 medication called Manjaro, and in the course of 2023, I was able to lose about 75-ish, 80 pounds. Was feeling great, but still was not having any kind of period. Move forward to the beginning of 2024, and we were like, okay, I really want to not only lose weight and focus on our health, now we want to pinpoint health to fertility. So I continued on my GLP-1 medication. And then I decided I was going to see a reproductive endocrinologist just to run the test, see what was going on, and see kind of what our chances were so I could prepare myself mentally. One of the guys I worked with and his wife, unfortunately, had multiple miscarriages and were dealing with infertility. And so she had gone to see this reproductive endocrinologist in Atlanta. And they thankfully gave me their contact information. So I said, okay, let's go check it out. So I go to this reproductive endocrinologist, and she's amazing. She was like, all right, here's the plan. Since we weren't in any rush to conceive, it was kind of exploratory and, again, our prep season, so to speak. So the reproductive endocrinologist runs all kind of blood work, all kind of tests. We do a transvaginal ultrasound there as well, and she checks out my eggs. In this test, she does discover that my FSH, I think it was, I know they tested LH and FSH. One of those was low, and that correlated with egg count. So it was a little on the lower side, but she said, again, nothing really super concerning. It wasn't crazy low. We also got my husband tested, and his sperm count also was on a little bit of the lower end. She confirmed that PCOS, you can get pregnant, but there are some challenges that can come along with it. So we were going to focus on the things that were the underlying cause, like not having a cycle and not ovulating. She tells me to continue my GLP-1 medication, and then she also recommends us getting on a few different supplements. One, a myo-inositol powder. The second I think she recommended was a CoQ10 supplement for both myself and my husband. And then she also put me back on metformin. I was very hesitant about this because of the terrible gastric issues I had prior to this with metformin. She ended up giving me a lower dose and an extended release dose and told me to kind of slowly titrate up. So I would take, I think, a half a pill for a week, and then I would go to one pill the next week, and then a pill and a half, and then 2 pills, and just slowly titrating up that way. Thankfully, that did not mess with my stomach nearly as bad as it did the first time, so I was very thankful for that. She said just to keep monitoring, we'll keep tracking my cycle and see if we can get that regulated, and that was going to be step number 1. Like I said, she also recommended supplements for my husband, and then also prescribed my husband Clomid. So Clomid is very usually known for being a drug that is used to induce ovulation for women. Clomid, letrozole, kind of those drugs in that category. But she prescribed it for my husband and said that that could help sperm counts as well. So we continued on, and my goal at that point was to be able to regulate my cycle and track ovulation. In this time, I was also seeing a traditional Chinese medicine practitioner. Her name is Wendy, and I swear if you need a TCM practitioner in the Atlanta area, let me know, because she was one of the major highlights in all of this. She was the sweetest Korean lady and was so positive and so helpful in helping me understand my body, not only in a medical sense, but also in a holistic and natural sense, which I love. So we went through my history with PCOS, kind of the things I was dealing with. So she tailored her acupuncture approach to getting blood flow and circulation through to my uterus. Now, do not ask me how acupuncture works. I think it is fascinating, but I am not a practitioner. So do your research. I know some people think it's woo-woo. I loved it. And if it didn't help me get pregnant, at least it helped me relax. In combination with acupuncture, Wendy would also brew up these herb packets. So she would make these herbs specifically tailored to my issues, to fertility, all of that. And she would make them into a tea and then seal them in these little packets. And I would drink this twice a day, and it was terrible. Now, I do think it is so beneficial, and I love all natural herbs and all of that kind of thing, so I know that played a role in it, but man, it tasted disgusting. So I was going to acupuncture once a week, and each week she would brew a different batch of herbs depending on where I should be in my cycle. So after a few months of the supplements and the medication from the endocrinologist, the acupuncture, and herbs, I started to get my period back. Now, it was extremely irregular still, but it was regular enough that I could start tracking. I am a researcher by nature, so I was trying to learn all of the ways to be able to predict ovulation, from basal body temperature to cervical mucus to ovulation strips. I tried the basal body temperature method, which you have to get a specific thermometer. It measures your body temperature to the 10th decimal point, but you have to be super still and hold it under your tongue for so long. And you have to do it as soon as you wake up before you move, because when you move, it can rise your body temperature. And so I just did not have the patience for that. We tried that for 2 weeks and then I was over it. So now I have a basal body temperature thermometer sitting in my nightstand that will probably never get used again. Also looking for changes in cervical mucus. Sorry if that word is triggering. I know some people hate it, but I'm going to use it because it is what it is. So looking for egg white consistency mucus. And I was on that because that was something easy to do. And then the real easy, and I think it's kind of foolproof, is ovulation test strips. Now, I looked into some of the more expensive and more in-depth test strips, but I did actually just end up buying a box of, I think it's 100 count from Amazon, of just the small little strips. My endocrinologist had recommended that once we kind of regulated my period a little bit, to start testing at the next day after my period ended, and then continue testing morning and nighttime until I got my next period. So I went through a lot of strips and I got so detail oriented to the fact that I started a binder, and I would write the date and then I would tape my ovulation test strip and be able to compare the lines on them, because they pop up like a line similar to a pregnancy test. except there's always one line, and then the second line gets darker depending on your ovulation time. And so I wanted to be able to physically look at it instead of just logging it on an app or something like that. So 3 months of this, we continue on. My period and cycle has gone from non-existent to roughly 35 to 45 days. I don't think I'm ever going to be a perfect 28-day cycle girly, but they're out there. PCOS girls can do it too. I just am not one of them. So we were able to keep tracking. I had a reproductive endocrinologist appointment in early September. At this point, we still were not pregnant. And she says, okay, like, keep doing what you're doing. I was still continuing to lose weight. She was hopeful because I showed her my crazy person log of ovulation strips, and she was hopeful that we were being able to track it. She said that towards the end of the year, if I still hadn't gotten pregnant, that we were going to do a saline ultrasound. I went home after that appointment, and that sounded not fun, and so I was not looking forward to that. But thankfully, we didn't have to do it because towards the end of September, I ovulated, we tracked it, we did the baby dance, and I found out I was pregnant. One thing I also did when I tracked ovulation at that time, I had seen this on TikTok, so I have no idea if it's legitimate or not, but I saw people taking Mucinex when they ovulated because just like it takes away phlegm and mucus when you're sick, it can also thin cervical mucus is the concept, I suppose. And so I took Mucinex that cycle. Again, who knows if that added to our chances, but something to mention. So finding out I was pregnant, I was still tracking ovulation. Obviously, I hadn't had my period, so I was tracking with my little test strips. I was actually running kind of low at that point on my test strips. But in the huge ovulation test strip pack, you also get a few small pregnancy test strips. Literally just the strips, not like a fancy stick test. And so we had actually gone to a Braves game with my sister and her husband the weekend before. They were in town. And I don't know why, something in me, like they were drinking some beers. I was like, nah, I'm fine. I'll just drink water. I don't know why, because I would have usually enjoyed a beer. Maybe I was just hopeful. And so the next morning, they were still in town and we were going to go to brunch. Took my ovulation test in the morning like I normally do. And I was like, you know what? I'm just going to take one of these pregnancy strips too. So I take it, dip it in my cup of pee, and continue to get ready to go to brunch. I'm like, okay, you know what? I'm just going to record this just for good time's sake. Because at this point, I hadn't really been testing a little bit, but again, I was just focused on regulating my period, and I mentally had convinced myself that it was going to take like at least maybe 2 years. We were fine with that. And so I take the test, I'm recording, and I look at that little strip test, and I'm like, oh my God, there is the faintest of faint lines. What is happening? I'm literally in disbelief. So excited, but I don't think I believed it because, again, I had been told with your weight, it's going to be hard. With PCOS, it's going to be extremely difficult or maybe never. And the endocrinologist gave me a little bit of hope, but still, I'm thinking years out. Well, after 3 months of actively tracking cycles and actively trying and tracking ovulation, we were pregnant. So we go to brunch. I did not tell my husband because I wanted to get a cute story and a basket and all of that kind of thing. So we go to brunch and I'm just having, I think, like an existential crisis. And again, no one has any idea. Everyone's just cutting up and talking. And I am just sitting there. I know I hadn't been acting so weird, but my husband told me he couldn't tell. So then we come home from brunch. I'm thinking, okay, I'm going to run to Target, get together a cute little basket, put in the pregnancy test. Because at this point, I also took a real pregnancy test and it came up positive as well. I'm like, okay, I'm actually going to tell my husband. Here we go. And so we end up getting to do something. We were like cleaning out our cabinets or whatnot. And I didn't get to go. That was a Sunday. The following Monday, I'm like, oh my gosh, I have to tell him. I went to work. I couldn't focus on anything to do with work. I'm like, oh my God, I'm pregnant and no one in the world knows except me. Another key point was that was a Sunday that I found out. That following Thursday, we had a family trip planned to Albania because that is where my husband is from to visit his family. So I'm like, oh my gosh, like I have to pull this together. I knew this was the first time my parents were meeting his parents, even though I'd been to Albania several times at this point. This is the first time they were going. And I'm like, we're going to have both of our immediate families all together. If I'm pregnant, I want to tell them. I know it's super early. I know people are cautious about that sometimes, but this is going to be the most special moment to have all of our family together for the first time and probably the last time in a while. And so I knew we wanted to do it. So Monday comes around and I decide the way I want to tell everybody are embroidered sweatshirts. So I joke with my husband and say, sorry, babe, the first person to actually know I was pregnant was the embroidery lady who I was asking to make these sweatshirts in a rush versus you. So sorry about that. But this embroidery lady was great and super excited for me. So that was nice. Fast forward to Monday evening. I'm able to go after work, put together a cute little basket with a baby blanket, a little book and the pregnancy test, and a little soccer ball rattle because my husband loves soccer. And he comes back home. He's sitting on the couch. I'm like, oh, I got you something for our trip. So I come out with this little basket. Of course, I set my phone up to record his reaction. And I'm like, okay, close your eyes. I give him the basket and wait to see his reaction. And he is stunned. Because again, we were mentally preparing for 2 or more years of this trying to conceive journey, and it had been 3 months. And so we cried. We were so excited. We were thanking Jesus, like, oh my gosh, we were so excited. So then also in that week, to note, I had been in contact with my reproductive endocrinologist, and she was able to confirm the pregnancy that early week with an HCG test. And then she also tested my progesterone levels. So the HCG test, I went, I think, Tuesday and Wednesday of that week. We were leaving Thursday. And the numbers doubled, which is what they wanted to see with the HCG test, even though it was super early. But she also tested my progesterone because she said with women with PCOS, sometimes their progesterone can be super low. And progesterone is super important in early pregnancy because your placenta hasn't really developed. And that is what then will give the progesterone the baby needs later on towards the second trimester. But if you don't have enough progesterone early in pregnancy, it can lead in miscarriage and complications. So she did test my progesterone and it actually did come back pretty low. Not scary low like some women with PCOS, but low enough to where the endocrinologist said, hey, we're going to get you on a supplement. So with that, I was able to fill that. They were actually suppositories. So one in the morning and one in the evening, I had to shove up a suppository of progesterone in my vag. And that way I had enough progesterone levels to help the pregnancy early on. So fast forward, we go to Albania, end of the trip. We're able to tell my family, his family, everyone is just ecstatic. They were, oh my gosh, over the moon. We come back and I am able to see the reproductive endocrinologist again to be able to do a transvaginal ultrasound. I think this was 6 or 7 week pregnancy at that point, and it was still pretty early to be able to see a heartbeat in the baby, but she was able to see a little bit of the baby in the sac, which is what she needed to confirm. And then the blood test obviously confirmed. So at that point, the endocrinologist gave me a hug and said congratulations. And they gave me then a list of referrals to OBs and any kind of thing I needed in the area. So I was researching which OB office I wanted to go with. I was looking at what hospital system they delivered at. Now, Atlanta has several different major hospitals. One of them is actually called the Baby Factory. And because they are pumping out babies, I think, more than any other hospital in Georgia and one of the highest in the Southeast, I believe. But they also get a bad reputation of really pushing induction, pushing C-sections, and not being great, I guess. I don't know. I've never experienced that. That's just kind of the reputation. And I also knew that I wanted to try my best to go unmedicated natural birth. So looking at that, I decided to go and want to deliver at the Piedmont Hospital System in Atlanta. And there were 2 OB's office through there, and I ended up going with one that was actually an all-female office, which I was excited about. So I start care there. We're able to schedule in for my first appointment. We do another ultrasound there, I believe. And in that one, my husband came with me. We were able to see the heartbeat. It was super special and exciting. She let me know that we were going to cycle through OBs at that point and kind of meet different OBs each appointment because you never know who you're going to get actually on delivery day. She also at that point told me that they were going to refer me to a maternal fetal medicine specialist because I was considered high risk. This high risk label was due to two things. One, BMI. At this point in early pregnancy, I think I started pregnancy around 315-ish pounds. And I also had a history of a pulmonary embolism. So back in 2015, I was living in Spain. I was on birth control. I was flying every weekend. I ended up getting a blood clot in my leg that moved up to my lung and was a pretty scary situation. Thankfully, was fine. Also did testing that I didn't have any genetic conditions that predisposed me to blood clots. So it was kind of a one-off fluke, so to speak. But in pregnancy, because estrogen levels rise again, that was something they wanted to take into consideration and also preemptively put me on blood thinners. So at that point, I started Lovenox shots, and it was not the most fun, but not miserable. The worst of it was it bruised my stomach so badly. So, I mean, I wasn't going to be going out wearing a bikini anyways, but I had bruises all over the bottom of my stomach where I would give myself the shots. I was a little hesitant with going to maternal fetal medicine at that point because I knew, again, in the research I did in trying to aim for an unmedicated birth, that a lot more monitoring means a little bit more of a medicalized push, in my opinion. They're looking more often, so there's more often things they can see to be able to push for induction, so to speak. But we continued on. My OB said, hey, if I had anything, I would want to go to them because they are more detailed. You get to have more ultrasounds and get to see baby more often. So I tried to look at it in a positive lens, which ultimately it was. I had no problems going besides the fact that insurance didn't cover it. That was annoying. But I did get to see baby every month early on and then more often at the end. Early on, I didn't have any crazy symptoms. I might have been a little more tired than normal, but the worst of the symptoms was the nausea. The nausea actually hit me towards the end of our trip in Albania, so it was before I went and saw the OB. Thankfully, my reproductive endocrinologist was able to prescribe me a medicine called diclegis, which is essentially an extended release combination version of B6 and Unisom. That did the trick for me as long as I took it regularly. If I did not take that, I was so nauseous. I didn't have a ton of food aversions, but smells bothered me a lot, a lot. Like my husband couldn't wear his cologne. I couldn't be anywhere around the living room or kitchen if the fridge was opened. And we didn't have a dirty fridge. It was just the smell of the fridge. Ugh, disgusting. My husband's car freshener. I couldn't wear my perfumes. It was just literally anything super smelly. Coffee was disgusting smelling to me. And that would then trigger a lot of nausea. I don't think it was to the point of like HG levels because I didn't actually throw up a ton, but I think if I hadn't have had that medication, then I would have been throwing up a lot more. It was still late first trimester or early second trimester, I think. We were having discussions. I was seeing the OBs, and a conversation came up when, in just casual conversation, she says, when we induce you at 39 weeks. And so I'm like, again, nothing's wrong at this point. I have no history of high blood pressure, no history of gestational diabetes. She did let me know they wanted me to test early for that because of PCOS and my weight, but I had no like real health issues at that point besides preventatively being on the blood thinners. And so I didn't really say anything at that first appointment, but I come home, talk to my husband about it. I'm like, that's not a great sign for me. So fast forward, I think it was another month when we go back to the next appointment, and it's brought up again when we induce you at 39 weeks. And so I told her, I was like, honestly, do we have to? And this OB that I saw originally was great. And she was like, oh no, we don't have to because you're on blood thinners. It's better for us because it's a more controlled environment. If we have an induction day, then we know you can stop so many hours ahead of time being on your blood thinner. And I was like, okay, like that's not ideal for me. And so I would prefer to not be induced if I don't have to be. She was like, okay, absolutely. Like, let me take it to the group. We discuss all of our patients each week and we'll see kind of the best option. There are other blood thinners that instead of taking 24 hours like heparin, that towards the end of pregnancy they could give me that were only 12 hours. And then that way I was at less of a risk for having it still in my system if we were to go into labor. And so I'm like, okay, great. Thank you. She was super supportive, understood where I was coming from. I told her I wanted to have an unmedicated birth, all of that. So not much else was brought up with it. They did want me to do my glucose test early at 17 weeks. Passed it, no problem. Did my glucose test again around 25-ish weeks, which is still a little bit early. I think the normal is 28 weeks. Again, no issues. Also, the doctor never once made an assumption like, oh, you're gonna get gestational diabetes or you're gonna have high blood pressure. They never brought up my weight. They never made really any comments or made me feel bad about anything. And that was something I was nervous about, but I got good vibes from them. And thankfully, those vibes played out well. Like I said, I was 315 when I began pregnancy, and I gained a good amount of weight. I gained probably close to 70 pounds during pregnancy toward at the very end. And never once was it brought up. Again, recommended movement as much as I could, spinning babies, kind of getting his head down, but never was my weight brought up as an issue. And I honestly don't know why I gained that much weight. I know some women gain more than others. I think part of it was probably coming off of a GLP. So I stopped my GLP as soon as I found out I was pregnant. And so part of it is probably that in regulating. I ate pretty balanced. I'm not going to say I ate a salad and grilled chicken every day, but I ate pretty balanced and I continued light movement, all of that. So fast forward to the end of third trimester, we are getting everything ready and have my shower. It was magical. I'm super just excited about everything. We go on our baby moon on a cruise. One positive about being fat and pregnant is that sometimes you don't look specifically pregnant like a smaller woman would. And so I did go on the cruise a little past the recommended time for a pregnant woman, which again was like a week longer than they recommend, but we ended up going on a cruise. It was great. And then towards the end of pregnancy, I have this induction thought in the back of my mind, but they're not bringing it up anymore. So we get to 35 weeks and they want to start us on NSTs, which is a non-stress test for anyone that's new to the lingo. And that's basically where they put you on the monitor, have you sit for a certain amount of time, and track the baby's, I think, heart rate and movement. One thing about being plus size and having a larger belly or back fat are those bands don't fit the best. So I go in for the NST and the nurse tries to get me all hooked up. This is in the OB's office. And she can't quite get the baby on the monitor. The bands keep slipping. They try the trick where they roll up a washcloth to try to get it to stick, and it just wasn't going well. So we tried that for 20 minutes, and finally she was like, you know what, screw this. She said, we'll just have you do an ultrasound, and it's totally fine. They can do the exact same thing they need to do with tracking baby's movement and tracking his heart rate. So no worries. We want you to be comfortable. Great, thanks. So we go over to the ultrasound. Baby's looking great. He was just moving around all in there. He was head down pretty much the entire time. So I was super thankful for that. Hey, we're tracking. We're going to be able to have this unmedicated birth. I was super excited. So then we fast forward to 37 weeks and I go in for the appointment. I think this is one of maybe 2 or 3 appointments that my husband didn't go to with me. He had been to almost every other appointment, but I was like, no, this is fine. He was actually home. He didn't have work that day. And I was like, what? No, what? It's fine. You stay home. We were renovating the house during all of this. So add that to the stress of everything. And I was like, no, you finish up. We were down to the wire. So we need to be able to get things knocked out and have the house ready. So I go to this appointment. Again, we decided we were going to skip the NST and just go straight to ultrasound. So we do our normal check-in, weight, blood pressure, all of that, yada, yada. And she goes into the ultrasound. Now, one thing to note is that baby's movement was never super strong in the morning anyways. He usually liked to wait till I was getting ready to go to bed and then would start running a marathon and be crazy moving, jumping around in there. I had eaten maybe a handful of blueberries before that appointment and drank some water. So nothing substantial breakfast-wise. So in the ultrasound, they're doing what I later find out is a BPP in lieu of the NST test, which stands for biophysical profile. And again, I learned all of this information after the fact, but in that test, they are looking for fetal movement, practice breaths, amniotic fluid level, and I think muscle tone, so the strength of their movements. The amniotic fluid looked great, heart rate looked great, practice breaths looked great. His movement was just, he wasn't really moving, which again was not super uncommon for his morning times. I had felt him move on the way to the doctor's office, so I wasn't super concerned, but the ultrasound tech seemed a little concerned. She calls in another ultrasound tech and said, like, hey, he's not moving. Like, what do you think about this? And so she's looking and she's like, oh, we're just going to go get the doctor. Of note, I think this had happened one time before at an MFM appointment where he was just sleepy and not moving. And they had a buzzer that they like put on my belly. I called it the taser, but it was just kind of like vibrating. And I think it beeped or buzzed. And then that would like startle him awake and he would move a little bit. At the OB, they said they weren't allowed to do that later on. But the doctor comes in. It's an OB from the practice that I had never seen before. And she says, well, baby doesn't look like he's moving so much, so we're going to send you over to the hospital labor and delivery, which their office was connected to the hospital, thankfully. And maybe it's just time to have this baby. And I'm like, all right. And I'm just like kind of in shock at that point. My husband's not there. I don't have a hospital bag packed. I think we might have had floors in our house, but renovation wasn't done. And so all of this is swirling through my head. But again, I'm trying to stay calm. I know my body. I trust my body. I don't feel like anything was off with his movement patterns. But okay, I'd rather be safe than sorry. We go over to labor and delivery. Tell my husband, hey, I'm going over to labor and delivery just to be monitored and make sure everything's okay. He's like, do I need to come there? I'm like, I don't think so, but I'll let you know once I get over there. So I get over to labor and delivery and had amazing nurses. The nurses were so fantastic the whole time. I kind of tell them the whole story. And they hooked me up to the monitors. She's like, yeah, baby's heart rate looks good. Again, I felt him kick a couple of times, even from leaving the OB's office to the hospital. So I'm not crazy concerned at this point, but I did cry a little bit because it was just overwhelming at that point. But we're in labor and delivery and hooked up to the monitors. It looks great. I'm just sitting there like on my phone. I also had a doula, so I was contacting them. I actually went through a doula service that is called Two Doulas and Me in Atlanta, and you actually get to meet with two different doulas, and they work as a team because that way you're guaranteed to get one of them in labor and delivery in case another birth is happening or something. It's someone you know. So I've looped them in on the situation. They're like, keep me posted. The nurse continues to tell me like, baby looks great on the monitors, but they're going to wait for the doctor to come in and talk to me. Doctor gets pulled into, I think, 2 or 3 emergency C-sections going on. And so I'm in labor and delivery for maybe 4 hours at this point. The whole time I hadn't eaten. I was starving. But baby's moving. Baby's kicking more so than that morning. So everything seems to be okay in my mind. Nurse keeps saying, hey, doctor will be in. She keeps getting pulled. And I'm like, hey, should I tell my husband to go ahead and come up here? Or is there any concern? And she's like, honestly, he looks great on the monitor. So I don't think there's any concern, but the doctor will be in a minute. Okay, great. So I'm keeping my husband posted. Then about 10 minutes later from her telling me my husband doesn't need to come, she comes back in and says, actually, you might want to tell your husband to come. The doctor did say that she wants to move forward with an induction. Again, I hadn't seen the doctor at this point. And I'm like, oh, okay. I don't really want to be induced. And can I talk to the doctor about it? And she's like, oh, and she kind of like paused. She's like, oh yeah, absolutely. Like the doctor will be able to talk to you, all of that. So I think the doctor ends up getting pulled into another situation. At that point, my husband was able to get to the hospital. We lived about 40 minutes away from the hospital. He brings me Panera. I'm able to eat something. I had to ask if I could eat something because I didn't know if I was about to go into an induction, so I had to get permission to eat. Once I ate, baby was kicking up a storm. Again, his heart rate and accelerations had been great the whole time. So finally the doctor comes in and she talks to me and says like, hey, we consulted with your maternal fetal medicine team. They agree because of the decreased movements that we want to go ahead and have you move forward with induction since 37 weeks is technically considered term. I tell her, okay, I would really not like to be induced. Again, I know with all my research, I read Ina May's Guide to Childbirth. Like I'm pretty set on going unmedicated and as natural as possible. And when you start induction, you start what's called the cascade of interventions, because usually inductions lead with stronger contractions. Stronger contractions usually means you want more pain medicine or epidural. Epidural can stall you out, blah, blah, blah. So I'm going through all of this in my mind. And I tell her, hey, because baby's heart rate has looked great and I've been feeling him move, can we repeat the test, the BPP test, and if he's good, not move forward with induction? And she's like, well, like I'll ask maternal fetal medicine about it. You talk with your husband about it, and I'll come back in after I grab something to eat, because she had been just running at that point. I'm like, okay. So then another 30 minutes comes by and the nurse comes back in with the IV kit again. And she's like, all right, are we ready to have this baby? And I'm like, no. And so I tell her the whole situation, like, hey, I want to repeat this test. And she's like, oh, okay. And she wasn't really pushing it. She was just going on, I guess, what the doctor had told her or the information she was giving. She was amazing. And she's like, okay, let me go talk to the doctor. So the doctor comes back in and she basically tells me that since maternal fetal medicine had made a determination that we could repeat the BPP test, but even if it comes back perfect, their recommendation is induction regardless. And if I decide to leave at that point, I would have to sign myself out and sign a waiver against medical advice, or AMA. And I'm like, oh gosh, okay. Again, I talked to my husband about it because the biggest thing was I don't want something to happen, me push to not be induced, and then have a bad health outcome for the baby and that be on my conscience. And so we agreed, like, we're in this together. This is a decision that we think is best. He ultimately was like, absolutely, it's your body. You have to make the best decision. Talked to my parents, prayed about it, and decided, okay, let's repeat the BPP test. If everything comes back good, we're going to go home. If anything at all comes back negative, I'm going to agree, like, let's move forward with the induction. So we have to wait around another probably hour or two. I don't know. Time was a blur at that point. And they roll me down to ultrasound. The ultrasound tech that I got down there was amazing. She was like just super fun, and she redid the BPP test and she was kind of telling me more about exactly what it is. Again, I didn't know what they did earlier was even called a BPP test. She was telling me what it was called, what they were looking for. She said you have a time limit of 30 minutes and you need to see all of those things in 30 minutes to get a determination of a score. Each of those things gets 2 points for a total of 10 points. And then based on that, that's the health of your baby. That ultrasound tech gets me hooked up, finds baby. Within less than 4 or 5 minutes, he's checked every box. He's moving, he's practiced breathing, he's moving strongly. So the muscle tone, amniotic fluid levels look great. And so I tell her, like, okay, I think I'm going to sign out. And she's like, I can't give you any kind of medical advice, but if this were me, I probably would consider the same thing. So that kind of put a tick in my mind of like, okay, that's at least a little reassuring. So we go back upstairs and sign out AMA. So it was a long weekend. The office was closed. And so the doctor, when I talked to her while we were signing out AMA, asked, hey, could you come back tomorrow? We just want to have you monitored, like, and repeat the BPP these days to make sure everything's okay until your next OB appointment, which would have been, I think, Tuesday or something. And so I agree. I'm like, yeah, absolutely. I'm fine with testing. I want to make sure baby's okay. It was a little annoying because we were 45 to 50 minutes in Atlanta traffic away, but we made it happen. So we sign out. Next day, go back, repeat the BPP test, 10 out of 10. That ultrasound tech, though, actually came to our labor and delivery room, and she was training another girl. And at this point, I knew 30 minutes on the clock, because also at the OB appointment, I found out she only did it for like 15 minutes before they sent me over to labor and delivery with the possibility of inducing. So that was in my mind, that I now know we have 30 minutes, we're on the clock, we're counting these things. So this older lady ultrasound tech is teaching a new girl. And so I tell my husband, like, as soon as they start that test, you start a timer. Like, I want my full 30 minutes, and we're not going to get pushed into induction if it's not necessary. So start the timer, and she's like, this is what you look for here and up here. And she's going so slow. And in my mind, I'm trying to stay calm, but I'm like, lady, hurry it up. We got 5 things we need to check off, and we got 30 minutes. And it was like 29 or 28 minutes when she finished up. She's like, all right, you're good. Or actually, no, she didn't even say that. I asked her, like, hey, did everything pass? Because at that one, I couldn't see the screen to actually see the movements and things. And she's like, I can't tell you anything. I'm like, great. Okay, wonderful. So thankfully, doctor comes back in. It's a different doctor at that point. Says, okay, looks good. Come back tomorrow. Continue that process. Saturday, Sunday, Monday, Tuesday, I have an appointment. In this point, I'm 38 weeks and some change, I think, and they're really heavily pushing induction. She says, we're going to monitor you, but we really want to induce you at 39 weeks, so let's go ahead and pick a date. I'm like, no, I continue to decline the induction. All right, move forward. She's like, okay, well, you're seeing maternal fetal medicine at the end of this week anyways. Go to maternal fetal medicine, tell her essentially the same thing. She's like, well, we recommend 39 weeks, but everything does look good and he's passing the BPP continuously. I'm trying to stay super in tune with my body. We get to 39 weeks. And the OB that I see is very adamant that I have to schedule an induction. And at this point, I've declined and declined and declined. And so I feel like my pushback meter was getting a little low on juice. And so she tells me that they all met in their OB group to discuss their patients like they do. And all of them agreed that induction was the best way forward. And I tell her my concern of, like, I want to go unmedicated and give that the best chance. And she tells me, is going unmedicated worth having a stillborn? Oof, that one hit me. That one hit me in all of the anxiety that I'd had through pregnancy. That one hit me in the anxiety I had around declining the induction initially. And at that point, I just felt like I didn't have it in me to push back anymore. But I told her, okay, let me think about it and I will call in to get it scheduled, because she said you had to call in to the nurse line to schedule the induction. I'm like, okay, great. I will call in to confirm. And I kind of left it open-ended. I didn't confirm the induction. By the time I checked out, was walking to my car in the parking garage with my husband. We get in the car, like going down the ramp of the parking garage. The nurse calls me and says, so we're going to schedule your induction. And I just felt so defeated and just kind of held up my hands at that point. I was like, okay. So she tells me there aren't many slots left, so we have to get it scheduled. Okay, great. So we schedule my induction for my due date, which was May 20th. I felt a little strong-armed, but again, at that point, I'm tired. I don't want anything to happen to my baby. I now have that stillborn comment kind of circling in my mind. And I'm like, okay, well, I can still try unmedicated. I know women have gone through induction unmedicated before. I'm worried about the slew of interventions that could follow, including C-section, which I really, really did not want. But if this is what they think is the best for my baby, like, I don't want to be putting up a fight and it be on me if something happens. Which, looking back, I wish I would have given myself a little more willpower to push back. But it is what it is at this point. So fast forward another week. It's my due date. My husband and I have an induction booked for that evening. I was to come in at like 9 o'clock, I think. So we go out for our last little date night. We go to a really nice steakhouse in Atlanta that I love. And then we drive over to the hospital. She had told me that I was like maybe a tiny fingertip dilated and like 50% effaced, and his head was down. So she said that I had a favorable cervix at my last appointment, so then induction should be good. So we get there. They start cervical ripening because I still was only about a fingertip dilated. I did not want Cytotec, which is a common induction medication that is actually used off label. In a couple of the books I had read, it can, in some women, overstimulate the uterus, so I was mindful of that. So we opted to start with Cervidil, which is like a tampon-esque string thing that has hormones in it. They insert it right up close to your cervix, and that's supposed to help your cervix soften and then potentially dilate some. So we get there. I have like all of my supplies. I probably way overpacked. I was concerned that they weren't going to have a birth ball my size. I did have a room with a tub, which I was excited because I thought I was going to labor in a tub, not like a birth pool, but just like a bathtub. They did have a ball, so we didn't have to bring in my yoga ball from the car. We unpack, we get comfy. I did have my own birth gown, so I wanted to have a plus size birth gown that was comfy and not the hospital gown. And so we start the induction. They try to get baby on the monitor because they inserted the Cervidil. I'm laying on this paper thin hospital mattress with these monitors. The monitors keep slipping off. And so this is like 11 p.m. at this point. So I'm relatively tired. I'm at the end of pregnancy anyways. And I cannot get comfortable. And every time I even move an inch, the monitors were slipping off. They tried the wireless monitor, which I had asked for actually when we got there, but it wasn't connecting properly. So they told me I had to stay in bed to be monitored, which I knew, like, I was so stressed at that point because I wasn't going to be able to get up and walk around, which I knew could stall out labor. I was so uncomfortable and stressed, which I knew could stall out labor. I'm crying because I can't sleep. I can't hardly move. My back is hurting so bad because, again, I would try to like shift my weight onto a different hip. The baby would come off the monitor. They would have to come in. So the nurses were in every like 4 minutes, I felt like, and I was just overwhelmed. And so my husband asks, like, can we take the monitors off for a minute? Can she sleep over here for a minute? And this bed is like so uncomfortable for her. And the nurse at that point went and got the charge nurse. And I can't remember which one of them said it, but one of them said, well, labor and delivery beds aren't meant to be comfortable. Like, great. Thank you. You're really putting me at ease here, ma'am. So thankfully, they did have like an egg crate mattress topper. And she asked me if I wanted that, but she made it very clear that I couldn't have that during delivery. They would have to remove it. And I don't know why that was like brought up as such a hot topic. Like, ma'am, I'm going to be here for a minute. This is going to be a long induction. I know it. So we get the egg crate. I'm a little more comfortable. We're moving along. Next morning rolls around. I think I progressed to maybe a centimeter. They said, okay, with us being a centimeter, they could put in the Foley balloon. They put in the Foley balloon. Miserable. I had told her my concerns because I'd heard so many stories about that being so terrible for people. And she's like, yeah, I know some people can react badly to it. So we're going to increase it just a little saline, a little bit by a little bit. I was like, okay, great. This doctor by this point is actually the doctor that would then deliver my baby. And she was amazing the entire time. She was very like patient led. Here are my options, but you make the decision. Told me everything going on. Love her 10 out of 10. And so we slowly start increasing the Foley balloon, but even early on in those smaller inflations, it started hurting. And so at this point, they did give me the Cytotec. I think we moved along because I wasn't progressing. This is like maybe an hour later. And I started to be in so much pain from the Foley balloon that I had asked for nitrous or gas and air, however you want to call it. So I got the gas and air. I was able to breathe through. I don't even know if they were contractions. It was just like all the time cramping because of the balloon. So there wasn't any kind of rhyme or reason or timing I could do. And so we continue with the Foley balloon. At this point, I told my doula, I'm in so much pain. Can you please come? So she was actually coming for another birth, I believe, as well. So she came in, she set up a diffuser, she set up some lights, like had the mood going. And so that was great. But I was in so much pain from the Foley balloon. I was breathing through it with the gas and air, okay? I also had a TENS machine. So my husband had that hooked up on my back and it had like different settings. My doula showed me which ones like she recommended, and that thing was a lifesaver because finally, when I did start having a few more contractions that were actually like peaks and valleys, I was able to have that TENS machine. I would jack it up on the peak of a contraction and then I could turn it back down. But that thing, 10 out of 10, recommend to any and everybody going through labor. So we're continuing. I'm trying to walk around, but again, the monitors are slipping off. They won't let me do intermittent monitoring now that I've had side effects. So I don't even know. Several hours pass. And the doctor's like, okay, I think the balloon is about ready to come out. And so she grabs that balloon and kind of tugs it. And I tell you, my soul left the building. It left my body, left the building, gone. That hurt so bad that I think that was the absolute worst part of labor. Her hand is up there, she yanks that thing, and oh my God, like it gives me chills to think about to this day. Awful. And I think I might have screamed or I might have cussed also. I don't even know. I think, again, my soul left my body. I was out of body. And so after that point, she's like, oh, okay, it's not quite ready. She can tell I'm obviously in pain. So she says, like, oh, we can actually deflate it because you're right there. And I would like to break your water and do an internal monitor on the baby and an internal contraction monitor because we can't really get the strength of the contractions from these external monitors. They keep slipping off, blah, blah, blah. So I'm like, okay, I think about it for a second. But then I think, if you have to put anything up in me that is going to be as painful as that balloon you just tugged, I'm getting the epidural. Like, I can't. I was in so much pain at that point. Like, I don't even know if I was actually having productive contractions. It was just, at that point, I was like, screw it, epidural. She's like, okay, great. Which I also think at that point, if I had done the internal monitoring without the balloon, maybe I could have progressed and walked around and gotten him in a bit different position. But man, I was in so much pain at that point that I was like, nope, epidural. So she agrees. Anesthesiologist comes in. He's an older gentleman. I was nervous about the epidural being plus size. I'd also heard that they make your husband leave. Didn't make my husband leave. He was able to sit right in front of me. They just had me curl over the bed, and so easy. He was so nice. He talked through everything he was doing. He was able to get it. At one point, it felt kind of funny. It was like a clicking feeling in my back, but placed the epidural beautifully. I wasn't so numb that I couldn't like move my toes. I could still wiggle my toes and like shift a little bit, but it dulled a lot of the pain. So as soon as I have the epidural, she, I think, I don't remember if I was continued on side attack, but then she was also upping my Pitocin at that point. They're kind of in and out, moving me around on the peanut ball, but I am able to finally get some sleep on my egg crate that I knew I couldn't keep. We get to about 5 a.m. So we checked in 9 p.m. So 24 hours plus 5. So we're going on almost 30 hours of the induction at this point. And I was still only about a 5 centimeters dilated. So the doctor comes in and is like, hey, listen, we have you on almost the maximum dose of Pitocin, and it's been that way for a minute. But your contractions are not strong enough that we need them to be. I'm concerned that if we continue on this level of Pitocin, that what can happen is your uterus actually gets lazy and is relying on the medication to contract. And then postpartum, right after birth, you get a lazy uterus, she called it, and it won't contract back down, which could lead to postpartum hemorrhage. She told me that she would let me have about another hour if I wanted to see if I continued progressing. And I asked her, like, realistically, do you think I'm going to go from a 5 to a 10 in an hour? And she said, listen, I can't tell you that I've never seen it done because that would be a lie. I've seen it done maybe 2 or 3 times in my 20-year, however long career. But is it likely? I would venture to say probably not. And at that point I knew because it had been 30 hours and I'd only gotten to a 5. She said, do you want me to wake up your husband so you can talk to him and discuss? I was like, yeah, absolutely. Because he was snoozing over on the couch. So again, this was like right around 5:30. We talk and I'm like, hey, I don't want the risk of hemorrhage. My progression hasn't been great. I think let's move forward with the C-section. I don't want anything to become emergent. I appreciate that, like, right now, nothing's scary and the decision is kind of in our hands. So we talk about it. Again, we pray about it. I talk to the doula about it. And doctor comes back in and we're like, actually, I think it was a nurse, comes back in and we're like, okay, we're going to move forward with the C-section. So of course, at this time, it's then about 6:00. It's nursing staff change. So in the midst of them prepping the OR and prepping me, nurse changes are coming. And I adored my nurse that daytime. Like, that was with me for the bulk of the induction. Those nighttime nurses, questionable. The daytime nurse that was going through the bulk of it with me, outstanding. They're going through nurse shift change, but they told me the doctor shift change isn't for another hour. So I was going to get the doctor to deliver my baby. And I honestly think she would have probably stayed on to do it anyways because she had been with me, but I don't know that for sure. So they're prepping me. Again, nothing's moving urgently. Everything is just kind of quick, but not crazy. So it's just my husband and I in the room. Again, we're praying, like, just God, please let us have a safe C-section. I was so worried, not even for the surgery, because I had actually had stomach surgery before, but because of the healing. I have an apron belly. I was so scared of the incision healing. And I had done research on what is called a Prevena wound vac. And it's a little bit different than a traditional wound vac. It's like a vacuum pressurized dressing. And so I had asked the doctor up front when we were discussing having the C-section. She was like, yeah, I actually would have recommended that. I also had my birth plan printed out and in a folder. Now, obviously, nothing was really going to plan, but I had an alternative C-section plan at the recommendation of my doula just in case. So it was things like I didn't want my arms strapped down. I knew that would be anxiety inducing. I wanted, if possible, them to keep dad and baby in the room while they stitch me up, which I found out was against hospital policy, but they did kind of bend that a little bit for me. We'll get to that. So again, everything's moving pretty smoothly, nurse shift change, and they start rolling me. And I see the nurse that is going to be with me through the operation. And it's actually the nurse that I saw when they were trying to induce me at 37 weeks, who was so nice and so kind. And I was like, okay, great. A familiar face. That's wonderful. So they start rolling me back to the OR and they're suiting my husband up in his bunny suit. I tell him, please get a picture. And he's like, oh my gosh, I don't want a picture of that. And I'm like, no, we're going to have this memory. So we have a picture of him in his bunny suit. And so they roll me back. We're getting started and my doctor's in there. And then the anesthesiologist is a different anesthesiologist. It's actually a female. So I realized at that point that my entire OR is all females, which I thought was just a super cool thing. Not anything against the men, but it was just kind of a neat experience to have an all female operating room with doctors and nurses. So they're getting me prepped. They had this like inflatable, I called it our life raft. So inflated on the bed I was in, they scooched me over onto the operating table and deflated it. So it was actually pretty cool. So again, I'm 370 at that point. So I was worried that they were going to have trouble lifting me from bed to bed, but nope, breeze. It was no problem at all. And no one ever made any kind of noise or comment about it. So we get over there. They have, I forget what the word is it, but it's basically this like large Band-Aid type tape that they use to pull and tape up my belly. And so it's on my belly. They pull it up and it's like taped to my chest, I think. I don't know. It was just weird, but it helped hold that up to them have a clear space to do the incision. So they're getting me all prepped. They're giving me the medication. Whatever medication they gave me, I got the uncontrollable shakes. And I had heard at one point that if you stick out your tongue, it would help the shakes stop. And I don't remember what podcast or book or whatever I listened to that, but it was real. And so it said it like reset your nervous system or whatever was causing that. And so literally I was like shiver shaking uncontrollably. But as soon as I would stick my tongue out, it would stop. And so they're prepping me in the OR. And I know that anesthesiologist was like cracking up at me because I was just laying there like, ah, not making the noise, but tongue completely out to try and stop the shaking. I had practiced breath work all through pregnancy preparing for unmedicated. So I was trying to breathe and just calm my body. And so finally, like, they're all talking, getting everything prepped. I'm not worried. They did not strap my arms down. We're just chit-chatting, whatever. And so my husband wasn't in the room at this point, but I start smelling, and this is trigger to anybody, but I started smelling like burning. It's disgusting. Um, and at that point I knew they were starting because it was like cauterizing where they were cutting. And so I say, "Is my husband coming?" And they're like, "Oh, yeah, yeah, he's coming. We're just getting prepped." And I'm like, "Okay, I think you're starting, but okay." And so husband comes in. He is not good with any kind of blood, guts, gore, anything. And so he comes in and you can tell he is like visibly nervous. And I don't think he had seen anything at that point, but he was anxious. So he sits down beside me and they get going. I can't feel anything until they get me open. And then it was a ton of tugging, like not hurting, not uncomfortable. It didn't hurt at all, but I could like rocking my body. And I'm a big girl. And so they were really getting in there. And she tells me that the baby has moved sideways and his head was kind of lodged in my hip bone. I was like, great. He was head down the whole time. Of course, his head is in my hip bone now. That's probably why I wasn't progressing. And so she pulls him out and she's like, "Oh my gosh, he has so much hair." And the anesthesiologist actually took my husband's phone and videoed them pulling him out, which I wanted, and took some pictures. And I had actually asked for a clear drape, but they didn't have it at that point. Some hospitals will where you can actually see. But it was also hard because I was laying flat. My boobs were up in my face. There was a lot going on. But she took the video of them actually pulling him out. He had a ton of hair. He starts crying, and I'm just like, "Oh my gosh." I was so just happy. I start tearing up, and they obviously can't do the delayed cord clamping with a C-section. So I think they delayed it a tiny bit, like a minute maybe, and then took him over to the warmer. And my husband goes over, is taking pictures with him. He's crying. They're getting him cleaned up. I wanted them to leave the vernix on him. I requested that so they're not completely wiping him off. My husband brings him over to me, and I'm like, "Oh my gosh, my baby." And that moment I was so nauseous. And so I'm literally baby on one cheek, turn my head, and I tell the anesthesiologist, like, "I'm going to be sick." She's holding a tray on my other side. So I'm like, "Oh my gosh, my baby, beautiful." But over on the other side. And so I wasn't really holding him. My husband just kind of held him close to my cheek. And again, normally the hospital policy was for pretty quickly after he was cleaned up for my husband and baby to go to recovery while they stitched me up, but they allowed him to stay in for quite some time. I don't know exactly how long it took to stitch up, maybe 30 minutes. And I think 15 to 20 of those minutes, dad and baby were still there beside me, even though I was puking and kind of out of it. So then baby and dad go to recovery. I'm in my hospital room with them stitching me up. And it's such just like a happy, calm environment. It was so weird. Like, I was chit-chatting with the doctor and nurses. They were talking about trying to cut back on caffeine, and her husband told her that she was unpleasant with caffeine. And so we're just chit-chatting, and I'm just been cut open, gutted like a fish, and we're just chit-chatting about coffee, and my baby's in the other room. It was just a surreal moment, but it was so positive and not scary at all. So, note out there, even though I was pretty scared of a C-section and didn't want it, it was not bad at all. And I'm thankful for the medical team that I had during it that helped that situation, but it went well. So, stitched up, go over to recovery. Dad is doing skin to skin with the baby, which I told him I wanted straight away. Like, if I couldn't do skin to skin with him straight away, my husband had a zip up hoodie that we bought from Target like the day before. I said, "You do skin to skin with him straight away." He's like, "Okay." He says later that the nurse kind of gave him a weird look when he asked for that, but whatever. I get back to recovery. They give baby to me straight away. And again, it's one of those like instant love situations, which I was worried about because I've had friends that didn't feel that love or that connection right away, which is a normal thing as well. But oh man, straight away, I was so excited, so happy, and in love with our little boy. And so I wanted to do the breast crawl, which something if you do a vaginal delivery, they can put them on your stomach, and babies just have this instinct to wiggle their way up to the boob and latch. I wanted to have that experience. And so we did. I put him on kind of my lower stomach and he started to wiggle. And the nurse, I think like 2 different times, was like, "Do you want me to put him on your boob? Do you want me to put him on your boob?" And I'm like, "No, it's fine. It's fine." And I know she was very kind and like helpful. Like, she's like, "What are you doing, ma'am?" But he finally wiggled up and got right on and latched. And then they roll us over to our postpartum room. Nurses there, 10 out of 10, all of them. So good. They were then giving me a combination of Tylenol and Motrin, like on and off. But I wasn't in a ton of pain after surgery. It was all a blur. We were very tired. So I think we all took a nap. The next day, my family came and got to meet the baby. My son's middle name is actually named after my dad, and they didn't know the name. No one knew the name the whole time. And so they get to meet the baby. He's introduced and gets to see his name and cries, and it was all just very special. At that point, baby was latching, but it was extremely painful, and I already had started developing like blood blisters on my nips. And so I tried to see a lactation consultant in the hospital. She came in and she was super nice, but she was very young. And she was like, "Oh, do you have any questions?" And while I had done research on breastfeeding, I didn't know specific questions. And I told her, I was like, "It's very painful." And she was like, "Yeah, well, here, use some nipple cream and Silverettes." And so that was kind of the advice we got early on. I was able to get up once the epidural wore off. I was up walking pretty soon, very slowly, very carefully. I had the vacuum pressure dressing, like I said. So it was connected to this like battery pack type thing that I had like a necklace around my neck, and it was making like a kind of noise constantly. And so was able to walk back and forth from the bed to the bathroom and doing all of that. They were in checking baby's blood sugar because they said with the induction, sometimes their blood sugars can fluctuate. And so he was getting heel pricks pretty frequently, which was kind of sad. But he did fine. He was a tiny bit jaundiced, but never had any issues and never had to be under the lights. They asked if they could take him to the nursery and let us get some sleep, and I was not letting that baby out of our room, out of our sight. I had asked if the pediatrician could do his checks in the room, but they said no, so they had to go to the nursery. And so my husband went with him and was like peering through the glass to make sure like he was okay. Baby was never out of our sight. And that was probably just a crazy first time mom thing for me. But we got to day 2. So I had him on a Thursday. And by Saturday morning, the doctor came in and I was up walking, going from the bathroom. The baby was in the bath and she was like, "Oh, you look like you're getting around pretty good. You want to go home?" And I was like, "Yes, absolutely, please." And so baby was born Thursday morning. We were able to go home Saturday morning. Like I said, our breastfeeding was really challenging and it was very painful. And he had started losing a lot of his birth weight, which they said was a lot due to the fluids I was getting during the induction. He had like 12 pee diapers in the course of 24-hour period, which was way more than normal. And so they said a lot of that weight loss was just fluid coming off of him from the induction and fluids. But because of that, they also encouraged pumping. So I had started pumping, wasn't getting a ton, was trying to latch. It was painful. So I was very nervous about that point, but hadn't gotten into the full mental capacity of breastfeeding yet. So we get home, and I think that's when it all hits me. One, it's that time period of the hormone drop, but then I'm trying to pump. The pump I had at that time was the pink Spectra. And so you had to be plugged up to a wall, and I wasn't getting hardly any colostrum. We were using the syringes to pull up the colostrum. It was still so painful for him to latch, but I was still trying. And then he wouldn't take the syringe. I'm like, "Oh my gosh, our baby is starving." And then thankfully I had one of the first aid kits that have the pacifier that you can push a syringe through for like medication. So we were actually able to give him syringes of colostrum through the pacifier because he would suck on the pacifier. But oh my gosh, that first few days were a blur. Breastfeeding continued to be very painful. We kept it going though. And I think we tried for 2 or 3 weeks, and I had seen a lactation consultant. She kind of helped me with um, positioning, and she was great because she was also a plus size woman and a mom of four. So she talked through some different things that could help with breastfeeding, like rolling a towel up under your boob for larger boobs to kind of get it in a better position for baby's mouth, different holds like a football hold, or all the different things. So that was helpful, but I also was having a bit of an undersupply, and he was not transferring milk well. So we were supplementing a bit of formula early on, and then I was still continuing to pump. She recommended that I go see a doctor. He's actually a pediatrician, but he was going to evaluate him for a lip and a tongue tie. And then also he specialized in like supply. So go to this doctor. He says that he does have a slight lip and tongue tie, but he couldn't confirm that if they released it, it would make much of a difference with my boob shape and his mouth shape. They said something about him having a high palate too, I think. So it all played into it. And I had a lower supply. So he prescribes me a medication called Reglan, which again, I think is off-label use for milk supply. That comes with a set of side effects that are usually like anxiety, depression, all of that. So he asked me all of those questions like, do I have a history of that? Thankfully, besides your just average run-of-the-mill anxiety of the world we live in, I thankfully have not struggled with that. So he put me on that. We titrated up really slowly. I'm still pumping religiously, like every 2 hours we're up. And so I'm on this medication. It is helping. I'm also taking supplements to help like increase. I'm doing all of the things, eating the oatmeal balls, doing the brewer's yeast, all of the things. And slowly my milk supply does increase, and I get to where I'm really just enough. For this is about 2 months in at this point. However, I had noticed my legs beginning to swell quite a bit. And so we had gone to a checkup with my son with that pediatrician. And I asked him about it. He was like, well, since you're here, let me just check it. And it was him. And then I think a guy that was either doing his internship or med school, something like that. So they come in and they take a look, and they actually found out that Reglan has a side effect on some people of swelling. It's extremely rare, but I don't know the exact function of why that medication does it, but it did it to me. However, there is another medication called domperidone, and that is allowed in almost every other country except the United States. It helps supply a little bit better. It doesn't come with the mental health side effects that Reglan can. And thankfully, since my husband is from Albania, I asked his brother, hey, can you send us a 6-month supply of this and we'll switch when it gets here? And so I was like, oh, great. I'll come off the Reglan and I'll just switch to that because that actually just got delivered. And he says, well, unfortunately, that medication works the same in that regard to Reglan. So you would have the same side effect. So I left that appointment feeling so defeated. And when I tell you, breastfeeding and pumping and the whole feeding journey was mentally probably the hardest part through pregnancy, birth, and postpartum for me. I truly felt like a failure. I was always an advocate for like however you want to feed your child. I have zero judgment when it comes to that. But when it came to me, I felt like my body's not doing what I want it to or need it to. I'm failing my baby. It was just kind of a dark space for me, like really and truly. And when I left that appointment after having success on the medication, being able to become a just enougher, and now I'm going to have to go off that medication, I just felt like such a punch in the gut. And like all of this was for nothing. I've been trying so hard and I'm just not good enough, honestly, is what it felt like. Looking back on the other side of that immediate postpartum blur, I was so hard on myself. And I know this is the case for so many women, that I absolutely should have given myself some more grace. My baby was eating. He was eating breast milk, which is more than some women can do. And so I should have been thankful for that. But oh man, it was hard. And so we go through that. I'm still able to keep up is a just enougher until about 3 months postpartum, and then I'm able to keep pumping, but we're supplementing with formula. We did end up going with a goat milk formula because cow's milk started making him a bit gassy, but combination fed goat milk formula and breast milk. And then about month 4, I actually found a girl who is a complete oversupplier with her third baby and graciously donated breast milk to us. So we got donor milk for him. So again, I was combo feeding my milk that I was pumping, goat milk formula, and donor milk. So that was his complete feeding. So we get to 6 months and I decide, hey, I think I'm throwing in the towel. So my pumping journey ended right after he turned 6 months. It was probably about 6.5 months by the time I just weaned my body off of it. And after that, I really feel like my mental health improved from months 3 to 6. I was a little questionable there. My husband went back to work. I was struggling. The newness of the baby wore off on the people around me. And so it was just me at home with a baby and my thoughts, which for a minute was a scary place. But that improved. I kind of stopped pumping, was able to get out more with him, wasn't on such a strict cycle of I need to pump at this time, nap at this time, blah, blah, blah. And so after that point, I think the rest of my postpartum journey was just great. I am thankful I did have a village. Our parents lived close by. My other family lives close by. They brought us meals, my friends. I just am thankful for them checking in. Again, those first months are a blur, but my husband was incredible. Obviously, I couldn't hop up in the middle of the night and change the baby and do that, and he took the best care of us. He helped with my apron belly. After a shower, he would help me shower. I would hold up my belly. He would blow dry my belly. At one point, he's nose deep down there in my incision because I was worried it was infected. So, ladies, make sure you are in a relationship where a man would do that for you. That's how you know he's the one. It's not romantic. It's not beautiful. It's nothing you will see in a rom-com, but that's true love. He took such good care of us. Healing post C-section, easy breezy, beautiful. So very, very thankful of, even though it was a situation that went completely not how I wanted or anticipated, that I was well informed. I was able to advocate for myself. And overall, I would say had a positive birthing experience, even though it didn't go to the plan I had written on paper. I wanted to share just a couple resources of things that I found particularly helpful through my trying to conceive and pregnancy and postpartum journeys. So number one were a couple of books. So like I said, I read Ina May's Guide to Childbirth. This was definitely more midwife, natural birth based, but has a ton of great information and stories. I read Emily Oster's Expecting Better, and I loved that book. It put into real numbers and statistics the risks of things, the options you have in pregnancy. I thought that was great. Two of the podcasts that sparked this idea for this podcast that I listened to hours and hours of were The Birth Hour. Loved that podcast. And I actually took their childbirth course as well. 10 out of 10 recommend. And Australian Birth Stories. I loved Australian Birth Stories so much. I love an Australian accent. Would listen to that all day, every day. But listening to their model of care, a lot of them went through midwifery care. So that kind of leaned more towards my natural birthing, wanting to do it that way. But again, just consuming all of the birth stories. Two would be Facebook groups. So I was a part of a couple different plus size specific Facebook groups. And one is called Plus Size Pregnancy and Beyond. They're super active in their current moms, pregnant moms, asking for advice, giving information. So I thought that was really good. Three would be maternity wear. It's non-existent for plus size women. So I just sized up in clothes. I would get summer dresses and bike shorts and just size up, and was so much more comfortable than trying to squeeze into maternity clothes. In that same category, maternity labor wear. So finding a great maternity gown that is comfortable. There are several different brands out there. Love the option to have a comfortable personal gown. Obviously, during a C-section, I did have to move to the hospital gown, but throughout the whole induction and afterwards, I was able to wear my comfy clothes. And lastly, truly, truly just trusting your gut and intuition. Do your research, know what evidence-based information is out there. There's a website called Evidence-Based Birth. You can search different topics and realize what your risks are, because just being plus size does not guarantee you a specific outcome in birth. Sure, it can make risks for certain things higher, but it does not guarantee you're going to have it. You're not guaranteed to have gestational diabetes. You're not guaranteed to have hypertension. You're not guaranteed to have preeclampsia. You're not guaranteed to have a C-section. So just because you're plus size, know that your body is capable of doing anything a straight size woman can do. Don't let your doctor bully you. Don't let your doctor talk down to you. Don't let your doctor shame you. So make sure you get a care team that does not put you down, that tells you all of your options, doesn't tell you exactly what you want to hear. They want to be real and give you the information. However, they should support you. They should be willing to have patient-informed and compassionate care, and overall just be supportive of you. I'm very thankful that even though I did feel a little strong-armed at the end, that overall my birth experience with medical staff was great. They never made me feel bad about anything. It was a very positive experience. So don't be ashamed of your body. Your body can absolutely do anything a straight size woman can do. And I think that's it. I'm very passionate about this topic. I became such a birth nerd. And so I hope my story and these future stories of women that we're going to share helps you if you are pregnant or looking to get pregnant, or have been pregnant and are a mom currently and looking for similar stories to kind of compare yours to. I hope this is helpful, and I'm just so thankful for your support. I'm thankful for this community that we're creating here, and I just really hope you continue to enjoy this podcast. Thanks for listening to my story. Thank you so much for spending part of your day with us. If you enjoyed this episode and want more stories just like this one, please be sure to like and follow us wherever you listen to podcasts. Also, if you have a moment, please consider leaving us a positive review wherever you're listening to this show. These reviews are the best way for the algorithm to push out our show and get us in front of other plus-size moms who may be looking for a community like this one. Your kind words can help make sure that no one has to go through this journey alone. If you are a fellow plus-size mom and would be interested in sharing your story, please reach out to us at biggerthanbirthpodcast@gmail.com. Use the subject line, "Share My Story," and I will be sure to get back to you as soon as possible. Want to put a face to a voice? Head over to any of our social media pages linked in the show notes below to see more photos of today's guest. Any resources or topics discussed in today's episodes will also be linked below. Thanks again for being a part of the Bigger Than Birth community, and we will see you next week. Bye!